All right, today we are talking spondyloarthropathies, and basically if we look at the word itself, spondylo, which is spine, arthro, joint, and pathies, disease, right? So spine joint diseases. Now, these are appropriately called that because oftentimes the spine is involved, but not always. Now, under this, there is four main diseases states, and they can actually overlap. And you can remember them by the mnemonic pair. So psoriatic arthritis, enteropathic arthritis, which is oftentimes known as IBD associated arthritis, ankylosing spondylitis, and then reactive arthritis, which is also known as Reiter syndrome. And oftentimes there is a fifth undifferentiated spondyloarthritis thrown in there because it may not fall into these four disease states. So you can just remember by the mnemonic pair. Now, under psoriatic arthritis, there's also 5 subtypes, which could be talked about more in a different video, but basically, short summary would be asymmetric oligoarthritis, so a few joints, but not symmetrical on both sides. Polyarticular, more joints involved. DIP predominant, so the distal interphalangeal joints, kind of like osteoarthritis. Then there's arthritis mutilans, which is a more serious form, more erosive form of psoriatic arthritis. And then axial involvement, of course, involving the spine. And if we look at enteropathic arthritis, also known as IBD-associated arthritis, there are 2 types as well. So this is the polyarticular asymmetric, so less than 5 joints. And then there's type 2 polyarticular, greater than 5 joints, and it's often symmetric. Now the other ones, ankylosing spondylitis, reactive arthritis, can definitely manifest in different ways in different people, but there are no major subtypes. And so besides this way of categorizing it, the Spondyloarthritis International Society actually has their own classification. So this is an organization that started in the 1990s. And they base it on what type of the skeleton is involved. So if it's a peripheral skeleton here, so if we look down here at the appendicular skeleton versus the axial skeleton, the axial skeleton is just the skull down to the sacrum, and the appendicular is everything else, right? So the shoulder and distal to that, and the pelvic girdle and everything distal to that. So if it's just a peripheral joints only, there is different types of disease states under that. Now, what's interesting about that is if it doesn't involve the spine, it doesn't kind of match the word spondyloarthropathies, but anyway, spondyloarthropathies doesn't technically have to capture all spine disease. It doesn't have to have spine involvement. But the axial involvement, of course, then now will have the spine involved. And there is subgrouped into radiographic and non-radiographic. So they basically look at films, x-rays or CT scans to see if the SI joint is showing characteristics of dysfunction and change. And if there is, then it's radiographic. And then if it's not, then it's non-radiographic. Now, what's interesting about non-radiographic types of spondyloarthropathy is that you usually get a milder form of the disease, but to treat it, it's harder. There's lower response to treatments, and so those are the categorizations under the Spondyloarthritis International Society. Now, just real quick here, a few features of spondyloarthropathies. Some of the classics, besides the joint pains of the spine, is you can get dactylitis, which is dactyl is finger or toe. Itis, of course, inflammation. So you get these sausage fingers, and you can get sausage toes too. And it can be one joint or multiple joints. And then you also can get enthesitis. Basic enthesitis is inflammation of the entheses, or these entheses are basically where the ligaments or tendons attach to the bone. So you can see in this picture here, you have 3 different places where are entheses, and you see in this little picture illustrated you get inflammation there, and so that's enthesitis. Now, with most of these spondyloarthropathies, there are systemic involvement, so it can involve the GI system, gastrointestinal system, the dermatologic, cardiovascular, the eyes, and the bone. So we'll talk about that more in future videos.